Why would an injector bend their needle? You may have seen injectors on Instagram and YouTube bending their needle prior to procedure. And in this show, I'm going to show you a great technique, including how to curve a needle for vertical injections in the lip. So why would you need to bend your needle? Ultimately, this is all about reducing the amount of work your injecting hand has to do. If you think about injecting, a lot of the time there are different curves and structures that you're trying to go around, or you are trying to avoid other parts of the body that are blocking movement of that supporting hand. So when you bend the needle, you enable greater flexibility and greater control for that procedure. To make this real, let's have a look at a couple of examples. First example, an area that I like to bend the needle frequently in is when treating the distal aspect of the nose. This is particularly when I am treating sometimes that little V shape that you get, or trying to make the tip of the nose a little bit sharper. So first step is to make sure the bevel is facing the right direction. We usually want the bevel facing upwards, but there may be times when it's downwards, and whatever it is, you need to make that decision now, because this decides how you bend the needle and where the needle bend is, because you can't change it once there's a kink in the needle. We need to then slide the cap back onto the needle, and in the direction you want to bend it, you simply just lean within that instrument. So this is a nice clean place to bend the surface of the needle, and that's all I'll need to do. So that angle then gives me greater flexibility. So you can see how this bend enables me to stay at the right plane when I'm injecting. Now that I have this little kink, I can find my entry point, slide into the right depth, change angle so that I'm straight, then stay at the same depth as I slide all the way in. I can see the tip through the skin on the tip of the nose, which is a useful thing to know that you're doing. You're about to inject in the right place, and I can inject accordingly before sliding out. Another place that I've seen injectors use this, in fact, I was on a training day with the mastery students that I train at Skin Viva Training, and one of them told me that they had learned to bend the cannula when doing the gonial angle. And this is because where the shoulder sits with your patient, it's often quite difficult to find a good entry. And so a little bit of curvature in the instrument that you use enables you to accommodate for their shoulder, which is often in the way when you just want to treat the gonial angle, or if you're using a cannula that's going higher up the face. That little bend can be helpful in some instances, maintain the position or the depth that you want to be in, particularly when you're using a cannula and you can't get easy access because of the shoulder. There are actually multiple other places that you can also use this technique, and we'll cover shortly how to do this with lips and how to curve a needle instead of bend it. So how do you produce a curve instead of a kink? As you can see, these two needles are different. One is kinked and one is curved, and there's a different technique involved in each. So to do this, I take a regular pair of clinical pliers, which I use to open toxin, and then to keep things clean, I use a cotton swab. I then place the needle with the bevel facing the right direction, close the pliers tightly, create the first bend, and with pressure firmly on the needle, I then pull it out, which bends sequentially to create a curve. So first of all, why would we want to bend the needle tip? It's obvious when you look at the lip in profile that the curvature of the average lip, not all lips, but in most people, there is a curve. And if you want to maintain the same depth all the way around, if you have a slight bend in your needle, it makes this accuracy of following the curve a little bit easier. If you don't have the bend, you can still do it, but you just need to move your needle outwards. And it gives your brain a little bit more to think about than when you have the curvature. So the curvature should be a relatively gentle curve, and it enables you to hold that depth as you slide in more accurately. I had a great question from Nurse Jenna in Colorado, who asked around how bending the needle might affect the extrusion force. And she's correct in assuming that there will be an increase in extrusion force resistance. And for some people, you may notice this, but actually I think in most cases you won't. And the reason for this is because a bend or a kink in the needle is an incredibly short distance overall. And one of the factors that affects extrusion force, if you review Purcell's law, is the distance of the narrowness. So although there is now a smaller space for the filler to flow through, that smaller space is also incredibly small. So if you think about sections of a tube, we have only a quarter of a millimeter or so where it's narrower, and the rest of it is the same. So it's an increase, but it's not the type of increase that I think most injectors would notice with the average filler. Now, the big exception would be if you've already got a very thick and stodgy product that's hard to inject, and then you bend the needle as well, then you probably will notice it. But for most modern products that I use, the extrusion force is relatively low anyway, so a little bit extra makes very little difference. What are the other potential downsides from bending the needle? Probably the one that I've heard patients worry about the most, and particularly dentists as clinicians, is what if the needle snaps off because you've weakened it? So one simple way to avoid this is simply not to insert the needle beyond the kink. So wherever you bend the needle, you never go as far as that when injecting. I don't think mostly you'd need to do that. But that would protect you from that particular risk, which I think is very low risk anyway. I don't think these needles snap as easily in aesthetic treatments as they might in the dentist chair. The other thing is our needles are relatively short compared with many dental needles. Another potential downside when you first start using this technique is that you may forget that as you rotate your hand, you're actually changing the position of the tip of the needle, because rotation with a straight needle doesn't change the position. As soon as the needle has a bend in it, rotation will flex the tip of the needle and could end up in a very different place before you're aware of this dynamic. So always think very carefully about where the tip of your needle is, not the direction of your syringe, because that's no longer the same once you have a bend or a kink in your needle. So I hope this show has helped you understand in more detail why we bend needles, why it can be useful, and some of the potential downsides or difficulties when bending needles. We've also discovered how to curve a needle, if you didn't know that already, and how that can be useful in lips. If you'd like to learn even more about needle control, I've created a guide specifically about this. All you need to do is look in the description of this video, click on the link, download it, and you'll get that.